educational mission of this campus was one to enhance what was already present in Hershey and to give students a chance to go to a different location for their entire third and fourth year.
Penn State's mission is to bring a teaching campus here to University Park for medical education.
We've had a number of years of experience working with Penn State Hershey, and this year we welcomed 13 students to our campus. They're being taught by not only Penn State attending physicians, but also Mount Nittany Physician Group community physicians. And so they're getting both the academic experience as well as the community hospital experience.
In medical school, we're taught that you read one, see one, do one, teach one. So medical education depends on generation after generation of doctors to keep that motto up. So I'm now at the point where I'm teaching one, and I think that's important so we can keep good doctors.
We have a unique opportunity to draw upon the resources of University Park in a way of dual degree programs, opportunities for interdisciplinary education, as well as research opportunities.
I attended undergrad at Penn State, and the students, they were all very friendly, very down to earth, and I just really liked the vibe, so I knew that Penn State College of Medicine would be a good fit for me. The main thing that attracted me to the regional campus was that we get to work with attendings without any residents, no interns. You work straight with the attendings, which is an experience you're not going to get elsewhere.
When I do a procedure, since it's just myself, the patient, and the student, there's plenty of time for them also to take a look. We can discuss it right there. We can discuss it outside the room. We can look things up quickly in between patients and read about it.
Ultimately, I chose Penn State because of the people. I really got a sense that this was a community I wanted to be a part of. I think the biggest draw of the regional campus for me was working one-on-one with the attendings. I tend to be a little bit shy, and I think it's easy for me to hang back and kind of get lost in a larger group. And here you don't really have that option. You're the only one on a rotation. If the attending asks a question, they're going to be looking to you for the answer.
I've matched for residency at the University of Arizona for family medicine. So I think coming to the regional campus actually helped me to get letters of recommendation because I had the one-on-one interaction with the attendings.
Here, because of the smaller size, they'll actually be doing a lot of one-on-ones, serving as first assists in the operating room on procedures, assisting in deliveries and OBGYN and labor and delivery, things like that. So that is a fairly unique opportunity for these medical students here in a setting like Mount Nittany.
One thing I notice is that when the doctors look at their patient list, they seem to know them in friendly capacities outside of just being a patient. You can tell that you're going to develop really strong relationships with your patients. Congratulations.
Thank you. The patients all love the students. They enjoy the interactions. I think it makes them feel more important because they're participating in creating a physician for the future.
Mount Nittany Health is a full-service acute care facility, so we have physicians from almost every clinical service. Many of them will be participating in the teaching of these students. And so they'll be interacting on every level with almost every service.
They have already been assigned different rotations throughout their third year, and they will eventually be choosing fourth-year electives and acting internships. Students who come to this campus can go into any specialty that they're interested in. So each of those blocks has been established with a clerkship site director here.
I work very closely with the Senior Associate Dean as well as the clerkship site directors here at the Regional Medical Campus to set up and carry out the programming for the third and fourth years of medical school, as well as the textbooks that you'll need throughout this rotation. While it's impossible to anticipate every student need, I am here really to help find answers to their questions and really be able to find the resources that they need. I'm here as their advocate.
Attending the University Park Regional Campus will prepare me to really practice in any setting that I want. I'll be able to practice in a smaller rural area. I'll feel comfortable practicing in an urban area, really anywhere in between. I'm getting those skills here. Now I'm definitely feeling more like a real doctor, now that I'm wearing the white coat around in the hallways, seeing patients, so I feel like it's good to finally be able to do what we all envision ourselves doing at this point, and to be able to have more independence and more responsibility. Can you feel the baby moving around? Yes.
A medical student's experience here in State College is going to be a good mix of having all the benefits of a major Big Ten university 2 miles from the hospital with sporting events, cultural events, and just the energy of having 40,000+ undergraduate students here every day.
Since we are students, we get to do anything any other student would do. We get to use the gym facilities on campus, play squash and racquetball. So it's really nice to be able to head up there in my free time.
If you like entertainment, there's the Bryce Jordan Center, there's Eisenhower Auditorium. Downtown State College has a lot to offer in ways of social activities, shopping.
There's always something going on in State College, so I think it's cool to have a lot of things to explore and things to go do when we have a little bit of free time outside of school.
This regional campus, I feel, has the potential to be one of the best regional campuses in the country. We have a tremendous faculty of very dedicated clinician educators, and we are really excited and look forward to a long history of meeting students' needs.
I definitely feel like Penn State and the regional campus has prepared me to be ready for residency when I graduate from here and beyond that into fellowship.
The most rewarding thing is to believe that we're making a difference in training future doctors.
We want the students to walk away knowing that they had a great education, a great experience, and also got to enjoy life here at State College.